Hello, and welcome to Care Conversations. This is episode 8. My name's Jesse. I'm the Communications Manager here at Sioux Meno Health Center, and I'm your host. Each episode, I'll be taking you behind the scenes of what's going on here at Sioux Meno Health Center. I'll be joined by Taylor Anderson, who manages our emergency department. Taylor will be talking to us about patient care in the ER, patient volumes in the ER, and how our patients are seen and cared for after they are assessed for their illness or pain. We're joined with Taylor Anderson, who manages our emergency department. Thank you for joining us, Taylor. We appreciate your time.
Absolutely.
I know when people come to Sioux Meno Health Center and they need to access our emergency department, they'll come in and the care process starts with them doing registration at the front desk, and then they go through a process that's called triaging. So just simply put, what is triaging and how does that kind of kickstart the process of them getting the care that they need?
Absolutely. So triage is the process that we use to determine who needs to be seen first, how quickly do they need to be seen, based on the reason why you're coming to the emergency department, your signs, your symptoms, your vital signs, how severe they are. Those are all factors that help us decide.
So for example, say I come in, I might just have like a really sore throat and a fever, and I'm like, okay, I clearly don't feel well, I need meds, and I've been here first, but someone else could come in after with worse symptoms. Just because I'm here first, that doesn't mean I'm going to be seen.
Yeah, unfortunately, Sioux doesn't have a walk-in clinic. We don't have an urgent care center. And unlike a walk-in clinic, patients in the emergency department are not seen on a first-come, first-served basis. It's all based on acuity, risk factors, and always circling back to the triage score.
And I know sometimes there could be instances where people feel like they're waiting in that outer waiting room for a while as opposed to getting through. So just why might they be waiting out there? I know sometimes there's situations with our inpatient beds and high volume. So if you can just kind of explain that a bit further as well for people, just to help give them a picture of what they might not be seeing.
For sure. So, people are aware that our inpatient beds are limited, and when there's more patients than there are beds, we have to open what we call overflow beds, which basically just means an inpatient is waiting for a bed on the floor, on the nursing floor, and they stay with us in emerge. Given an already limited number of beds, stretchers, places to stay, it means that sometimes if you are medically and physically able, we have to kindly ask that you wait in our waiting area.
Now, and then I know there's also instances where I could be in the waiting area for a bit of time, and then someone comes in, they don't appear to be sick, and it appears that they go right through without even maybe triaging or anything like that. Can you help kind of paint that picture for people as well, for any patients that need to access day med, which they have to go through our emerge for?
Yeah, absolutely. And that could be for a couple of different reasons, day med being one of them. So day medicine, it's outpatient ambulatory care, patients that are coming to us either daily or multiple times a day for dressing changes, antibiotics, IV medications. So they actually don't need to see the emergency room doctor. They're just being brought in either into the emergency department, into a separate area, or actually straight through to day medicine just to see the nurse and receive treatment that's already been ordered or prescribed.
Exactly, which, for anyone waiting in the emerge, they wouldn't necessarily know that just by seeing it. They're just maybe sparks a bit of confusion just because they've been waiting there. They see someone going through, they just assume they're accessing the emerge when they're really not.
Yes. Yeah.
And then I know there's times as well where, say with my example again, I'm in the ER, I've got a sore throat, I've got a fever, but my condition changes. What should I do in that circumstance?
Absolutely. So we always want to know about any time that there is a condition change, because that might change the time frame that we would want you to see the physician, or it might stay the same, but it's something that we always want to be paying attention to, documenting, and making sure that you receive the care that you need.
Perfect. No, that's great. And even when it just seems like those patient volumes are really high, the emergency room is really busy, would I ever have to worry about not being seen at all?
No, absolutely not. No patient will ever be turned away. Again, we don't have a walk-in clinic. We don't have an urgent care center. In larger towns, larger cities, one thing that emergency departments are doing to help clients access the appropriate level of care at the appropriate time is they're asking patients and helping facilitate transfer to one of these centers. We don't have them, so unfortunately the only option we have is to wait until it's your turn to see the doctor. So as long as you're willing to wait with us, a doctor will see you as soon as it's your turn.
Perfect. That's great. Thank you so much, Taylor, for your time, and thank you for sharing that information. I know it's really hard to predict when our emergency department is going to get really busy, that high flow, but it is good to know that, these things are in place to make sure that all our patients will be seen no matter what and no matter how busy it is.
Absolutely. Thank you so much.
Perfect. Thank you. Miigwech, thank you for tuning into this episode of Care Conversations. If you've missed an episode or want to rewatch an old episode, all of them are available on our YouTube channel at Meno. To stay up to date on all things Sioux Meno Health Center, follow us on social media at the same handle at Meno. We look forward to bringing you more episodes. Until next time, stay safe and take care.